Let's go green. Sponsored by EirGrid, managing and operating Ireland's electricity grid for a cleaner energy future. Check out airgrid.ie for more.
Hello, and you are very welcome to this week's Let's Go Green here on Midlands 103. I'm your host, Aisling O'Rourke, and I hope you are safe and well as you tune in. I hope Samhain was good to you and you got some nice treats if you were out trick-or-treating. I had some bananas and Peaky Blinders called to my front door. I'm not quite sure I got the banana one, but the Peaky Blinders efforts were quite impressive altogether. And I saw some wonderful Joanne McNally's out on the trail as well on Friday night. But I hope you enjoyed it wherever you are tuning in from. On today's show, we are going to be talking to the newest Farming for Nature ambassador here in the Midlands about farming for nature and what that all looks like, and she's someone who didn't necessarily go straight into farming, so it's an interesting career pivot from our guest later on this week's show. But first things first, I want to talk about climate and our health, because a new report has warned us that we are heading towards quite a significant health and climate emergency. And that's the Active Travel, the Magic Pill report from the Irish Climate and Health Alliance. And to discuss this, I am joined by Dr. Caoimhe Clarke, who is a psychotherapist, but is also speaking on behalf of Irish Doctors for the Environment today. Caoimhe, you are very welcome to the programme.
Thanks very much for having me today, Aisling.
So, Caoimhe, give us an overview of this report, because some of the findings in it, they really are quite worrying.
Absolutely. So essentially, this is an evidence-based report, and we've gathered together all the latest data around health in Ireland, but specifically our health related to how we physically move. So the concerns is that we're actually quite a inactive population. So 6 in 10 adults are actually insufficiently active. And what we know is if we are insufficiently active, we are at higher risk of a huge amount of chronic diseases, which are preventable, primarily cardiovascular disease, stroke, diabetes, mental health illnesses, and dementia. And I suppose our report is positively reframing how we can tackle this through what we call the magic pill, which is effectively, you don't need a tablet, you just need to move. Mm-hmm. But that movement is just how you get around how you get around day to day from A to B. And we use the term active travel, which basically means walking, cycling, wheeling, using public transport, basically, walking to a bus and not using a car, or avoiding or reducing our reliance on cars, because literally every step counts, and that will offset these preventable chronic diseases. So for better health outcomes and a healthier population.
When we say that we are an inactive society, I think, it's important to say that as a society, and from the people that I meet in my day to day, we're all very, very busy. A lot of us are very stressed out and under maybe work pressures, economic pressures, trying to juggle work and kids, or, so it's not that we are, sitting around doing nothing. But we're busy perhaps in the wrong ways, in that we're not actually getting enough movement in. We're stuck at a screen all day, or we're behind the wheel of a car. So, people listening to this might think, but she hasn't a clue what I have to deal with on a day-to-day basis. Like, I just don't have the time for exercise. So talk to me about, the mindset shift that we need to embark on here. Because if we were in a different country, it would be completely normal for us to go on cycling holidays or, a walking holiday. Those things in Ireland, they tend to be for the people who are retired, or they're just really, really into it, but they're not common.
Yeah, 100%, and completely agree with all of that. But I suppose our report is a little bit different. We're talking about how we engineer simple movement and physical activity and embedded into our daily routine. So, for example, for me, I'm a community consultant psychiatrist. I'm based in the hospital, but I'll cycle to see my patients at home. I could drive. I choose to cycle. It's healthier for me. It's actually just more efficient. But I suppose the point I want to make about that is, we're as a doctor and healthcare professionals, this isn't about people making individual choices, because as you said, people's lives are incredibly busy. There's a lot of stress, and we by default have a lot more, I suppose, sedentary roles because of the type of jobs we all do. And I suppose our argument is that the health outcomes are influenced by society and systems. So basically, what I try to say to my patients is, instead of driving the car 2 kilometers down to the road to the local shop, can you get out for the few steps to get to the bus, which is 400 steps, get on the bus and then get to your local shop. So each of those movements in a whole journey approach is physical activity. And it's also really important for our mental health well-being. So again, as a psychiatrist, I'm really interested in the importance of the positive social collisions. So if you're out walking or cycling or on a bus or a train, you're more likely to interact with people. So that's really important for our brain health. We're also engaged with, let's say, the world around us, insofar as, you're probably going to pass a green space, or, you're going to meet other people on your route. You're not going to get that behind a car. So again, it's trying to embed the idea that actually the fact that you walked to the shop 2 kilometers down the road, that's hugely much more beneficial than you taking your car and basically not kind of saying to people, oh, you should be going to the gym 3 times a week, because that's not realistic. It's also not cost effective, and it's also, not time efficient or convenient. So if we can reframe it that actually me getting up and just, walking down the road for whatever reason, instead of taking a car, for example, is a much healthier approach. And it's that mindset I suppose we're looking at trying to shift, as you say.
There's a wonderful speaker in Duleek in County Louth by the name of Andrea O'Grady. And she has this lovely phrase, and she calls them movement snacks, because that's where her background is in encouraging people to move more. And I like that term, where we need to start about, we might not have the time to go for, an hour-long exercise class on a Monday evening, but maybe we could walk to the bus stop instead. Maybe we could cycle to school. Those smaller changes, but still it does involve creating new habits, and sometimes that's a challenge.
Absolutely. And we know that, from the psychological perspective and human behavior, it takes us a while to integrate a new habit. I think is it something like it takes 30 days to break that cycle. And it is a challenge. You can't just expect people to kind of change overnight. And I suppose our report kind of focuses on, again, this is not to blame individuals for inactivity. And I don't like using the word blame, but essentially we need to give people options.
Yeah.
So if you want to break let's call it break a habit, and instead of driving the 2 kilometers to get to, example, school or to your job, and if you have a safe pedestrianised footpath, or you have a safe segregated cycleway, or you have a convenient bus or train to reach that destination, the system around you is promoting and supporting you changing your habit. And I suppose that's where our report really is putting it to national government, that we think that transport policy is a health policy. So we need the wider system to support our population to make healthy choices that they probably will make if it's there for them. And habits are hard to break. So you can't expect people to do it without a structure and support around it.
But it is important that we have the infrastructure, because if we can't, and particularly if you need to get a child to school for 8:30 in the morning, or you need to be in the office by 8 a.m, you need to know that if you choose to use public transport, that you will get there on time. And at the moment, we don't have that, unfortunately. So talk to me more about the report and that challenge really that you are putting up to the government.
Yeah, no, absolutely. And I 100% agree. And it's really so unequal across the country. And I've been having lots of conversations this week where often the urban rural perspectives and differences. So like, I'm biased. I live in city centre Dublin. I'm incredibly lucky. I've got access to the active travel network around me. But as you said, if I have young children and I have to get to 3 different destinations in a very tight amount of time, that requires a lot of organization, but also, as you say, like effectively a really slick, user-friendly, accessible public transport or active travel network. I think the focus really needs to be with government rebalancing resources away from, car dependency and putting that money and that transport infrastructure in place nationally.
Yeah.
And knowing that we're going to get the health outcomes in the future, when you've got a population who'll engage with that active travel network. We've kind of in a report highlighted to government the cost savings. So I suppose this sometimes helps reframe it for people. It was in 2023, and this was only in the Greater Dublin area. People who were walking and cycling, they effectively worked out that they saved the HSE €64.5 million because basically they're not getting sick. So again, this is very doable. We just need the political courage and national government to look at the policy decisions they're making and how that plays out on basically what they're building. So it could, a good example as well as it comes to even urban planning, if you're building a new housing estate, it's not much point if it's in the middle of nowhere and you're surrounded by roads. There should be a safe pedestrian route to a school, to the local shops. There should be a segregated cycle path. There should be a local link bus. These are all really important decisions that the government need to incorporate the health of their population when making these practical, hugely economic, expensive, I suppose, decisions. But the long-term payoff for a healthy population is huge.
I always, where I live, I'm very near a relatively new train station. Okay. Mm-hmm. It was built before the crash, then the crash happened and it only opened recently. And people who know the story will probably know where I'm talking about, but there's no car park there, right? And it always it frustrates me because I don't use it because I can't, to get there I'd need to drive because it's just that bit further. As a commuter, it'd be just that bit too far to walk. And it's like that would be an ideal park and ride facility to get more people out of their cars into the city onto our feet. So we don't seem to have, like you say, the Department of Health and Department of Environment and Transport, we don't seem to have all the heads working together. We seem to have a system where everybody's off into their own little silos. How do we make that shift? And I know you mentioned their political courage, and it is really about having, the political courage to maybe speak out in a way that might not get you re-elected.
Yeah, exactly. That's the reality. I completely agree. And I think that's one part of our report is, highlighting that. I suppose to bring it back to us as doctors and healthcare professionals, I do feel strongly about this. The onus is on us to also speak out and push for this. I think we need to be louder. I think in other countries, health is at the table. It's at the governmental level. We, as doctors and healthcare professionals, we look at evidence. We're not just going to pull this information out of nowhere. It's based on fact and it's applicable to a general, population. So, how I would see it is, we're happy to help. So if we could kind of get at the seat with government to help them integrate the systems and which will, I suppose, make these decisions at national level, again bringing it back to the health population, what am I trying to say? I suppose we need to be at the table talking to government as healthcare professionals to help them understand that transport policy is a health policy.
Well, Dr. Caoimhe Clarke has agreed to stay with us. So we're going to take a short break and we will be back in a few moments to time to talk about that connection between health and transport and tackling climate change. Stay tuned.
Let's Go Green, sponsored by EirGrid, managing and operating Ireland's electricity grid for a cleaner energy future. Check out airgrid.ie for more.
You're listening to Let's Go Green here on Midlands 103, and I'm delighted to be joined today by Dr. Caoimhe Clarke. And Caoimhe is of the Irish Climate and Health Alliance and also Irish Doctors for the Environment. Now, Caoimhe, we've been speaking about the new report that you've been involved in putting together, Active Travel, the Magic Pill. For listeners who are listening to this show and are maybe thinking, yeah, do you know what? My life has become a little bit sedentary for whatever reason. And you mentioned earlier on this idea of embedding movement. From how much money or can we save by having a more physically active population?
Yeah, I suppose a lot is the simple answer. And I suppose the report kind of throws out a couple of numbers there. The big one that we kind of focused in on was the numbers that were noted in 2023, whereby physical activity, specifically walking and cycling, has saved the HSE €64.5 million. So that's a lot of money. I suppose anecdotally, as a doctor, like how we're going to see that play out is less people waiting in the emergency department, less people in beds in hospital, less sick days at school. And I suppose the flip side of that, and I don't like to kind of focus on the negatives because I think there's a lot of hope and scope for improvement here. But we also know that unfortunately, insufficiency, inactivity in our population also has cost the state €1 billion, and that's specifically health costs. So, you look at both those figures, and if we could just flip them around, we'd be heading in the right direction.
And talk to me about those costs, because if you have a more sedentary life and you are, and again, just to stress, we're not saying that anybody is in any way lazy. We understand that we all have very, very busy lives. And I'll be honest, I find my life is very busy and very stressful. And I do find it hard to get in that physical activity. Although I know when I do it, I feel so much better. But it's, it's leading us down the road. Like you mentioned, the idea of stroke and diabetes there. Now I know there are many different types of stroke, like there's many different types of diabetes, but, they're just two ways that we could actually reduce the significance of it. If we got moving, we would have less strokes and less impact on the health service. It's a chain reaction, isn't it?
Exactly. That's the perfect word for it. It is a chain reaction. There's so many preventable chronic illnesses, and we talk about things like, as you've mentioned, stroke and cardiovascular illnesses and diabetes. But some of the ones that people maybe don't talk about enough also is mental health illnesses. So we even know that if you walk for 30 minutes a day, and that could be just you walking around your office or walking up and down stairs at home, that hugely reduces stress, anxiety, and also is prevention for depression. And I suppose the other piece that I also like to focus in on is brain health. So we now know that as for having a healthy brain, we need to be socially connected as well as physically active. So there's so many health benefits from physical activity. The costs just mount up and up when we're going to ignore it. And I suppose that's the concern of the report. And again, it's coming back to this physical activity really is just movement within your daily life. We like to call it, that is your own medicine. And we're very conscious that people have very, very busy lives. But if we could just get people to remember all of those individual steps literally are going to be hugely beneficial, for the future health of you and society.
I remember I'm type 1 diabetic, and as a result I have diabetic retinopathy, so I have to go to an ophthalmologist on a unfortunately regular basis. But I remember being told at one point, and it stuck in my head because it was something I hadn't been told before, about the importance of getting fresh air every day and our eye health. And I think sometimes as a population, we're rather uninformed about the benefits of movement and getting fresh air, that we don't know enough about our bodies. Like, do we need to be educating people more, as opposed to on maybe specific illnesses, but more about, actually getting out and moving, and maybe even if you're really annoyed in the office, doing a walk around the building has a significant health benefit?
Absolutely. I 100% agree. And it does come back to what we talked about earlier. As doctors and healthcare professionals, we should be communicating better. It should be more compelling. It should be clear and accessible. I suppose I like to talk about this particular story if it kind of gives a bit of context to it. I was out seeing one of my patients at home, and he's a gentleman who he thought he's going to lose his driving license because of an early dementia and some other, illnesses, some of which are age related. And we talked about how life would be without his car, because, for him, it's a real source of independence. He's had it for probably 60 odd years. But we then talked about how he liked to take the local bus to get to his destination, where he used to go for a walk and he used to go for a coffee. And we looked at those two journeys separately. So when he took the car, sometimes it was slow because of traffic. And when he got there, compared to when he walked down to his local bus stop, and we talked about how he loved having a chat with the bus driver. There was incidental chats with people on the bus, that he had a couple of extra steps further to walk from the bus to the local coffee shop. And I suppose we were talking about how important that was for his brain health, because at the time we were talking about his early dementia, but he was still quite functional. And, the loss of independence because of this potential, he wouldn't be able to drive anymore. And suddenly the benefits of all of the physical activity that was going to help his brain, help his bone health, his muscle health. And we know in older people in particular, walking is really, really important for osteoporosis, coordination and balance. So suddenly when we had this conversation, we're like, this is a no-brainer.
Yeah.
Excuse the pun. It just made sense for him. I suppose there's that thing around, maybe as healthcare professionals, how we communicate.
And that can be really challenging if you've only got, if you're going to a GP and you've only got 10 minutes for each patient. It can be hard to, to make the time to somehow have a more nuanced conversation, as opposed to, okay, Johnny, what's the problem today? Okay, here's the prescription. We'll get this. This is how you take it. And before you know it, the 10 minutes is up. And around, how we, if that idea that, if we're walking more in older age, that we have less trips and falls. Like any older person I know, the big fear is that they'll have the fall. And it's like a sign of aging that they'll have had a fall. It's a change of conversation and language around it. And that could be the one that breaks a hip and puts them in bed. Or, that if we only knew these things, that we would be doing them every day.
Yeah, absolutely. And I think you hit the nail on the head there. And I think it's true in healthcare, time is pressured. I suppose maybe as a psychiatrist, we were always taught that every interaction with the patient, there's every opportunity to motivate that person to, reframe what they're doing in a better way for their health. And I think sometimes maybe in my job, I'm quite lucky. I often do have the luxury of time, but that doesn't happen across the whole spectrum of medicine. So I suppose maybe, we're doing that in our daily jobs as best we can, but there is that other piece then that we do need to speak out louder, and the education needs to be broader. And I suppose if we had the active travel network and the appropriate infrastructure, people would just be doing this anyway.
Yeah.
So that's, I suppose, isn't that the...
And then, of course, you have in turn the environmental benefits, because less of us will be in our cars, less of us will be, using fossil fuel driven vehicles. And it would have, and that in itself, because we all know those massive fines are coming in 2030 and 2040 and 2050, it would save the country millions, if not billions. Based on your own data, if we just use that as a data point. But before I let you go, Caoimhe, how important is it that we are talking to kids about this as well? Because I'm old enough to remember, the big shake-up when the plastic bag levy was coming in, and when we started learning about smoking being bad. And I've said this on the show before. I remember going home from school and giving out reams to my grandmother about her smoking at the time, and giving out to my parents they were using too many shopping bags. And there's nothing more blunt as a mildly educated 7-year-old. So, how important is it? Because we do, and I see it myself and the young people in my life, they're on their phones sitting still all day, every day. That's a massive cost waiting to happen.
Absolutely, 100%. And children are absolutely key. And there's loads of evidence there when you look at kind of behavioural psychology, the behavioural psychological perspective on things. Kids are great. Kids are honest. They're going to say it as it is. And I think going, if you can convince that population and educate that population, they're going to be like you, Aisling. They're absolutely going to go home to whatever adult is in that house and kind of name and shame. And that's very powerful. And I think in Ireland, that's a very powerful tool. We're a pretty kind of self-conscious.
Yeah, because we are you see youngsters, and even if you go out to a coffee shop and you see it used to be a case of God, I wish they'd calm down and be quiet because I wanted my quiet cup of coffee. Now, actually, it's silence, and it is so sad. And you wonder about the long-term health impacts and then the economic costs as a result.
Absolutely. No, I genuinely think it is a problem of our time. And I think most countries are worried about that. And as you say, you're seeing the teenagers or young adults already more sedentary on their phones. We have an opportunity with the younger children. That's where the education needs to come in, and quite urgently, I would argue. And I know there's lots of discussions around kind of mobile phones in primary school and secondary school. And some countries have taken very kind of hard and clear stances on how they're going to address that. And I suppose, again, in most countries, things tend to follow when policy sets the tone.
Okay.
The big thing is implementing it, though. And I suppose that's another piece in our paper, in terms of, we have lots of policies to promote physical activity in Ireland, but we really need to implement them now going forward.
Well, Dr. Caoimhe Clarke, thank you so much for teasing this all out with us here on Let's Go Green. And of course, Caoimhe is with the Irish Climate and Health Alliance, and also Irish Doctors for the Environment. And if you want to find out more about that report, just Google Active Travel, the Magic Pill, and you will find all the information there. Caoimhe, thank you very much for your time.
Thanks so much, Aisling.
We'll be back after the break.
Let's Go Green, sponsored by EirGrid, managing and operating Ireland's electricity grid for a cleaner energy future. Check out airgrid.ie for more.
You're listening to Let's Go Green here on Midlands 103, and I am delighted to be joined now by Offaly's newest Farming for Nature ambassador, Margaret Edgill of Mount Briscoe Farm. Margaret, you're very welcome to the programme.
Thank you.
So, Margaret, before we get into becoming an ambassador, talk to me about your own farm, Mount Briscoe. What exactly is it that you do?
So we're a beef suckler farm, mostly traditional and rare breeds. And we don't finish, we just sell weanlings off a grass-fed system. I also do breed Irish draft horses. So I have a number of mares, and then produce foals, which again, we sell those. And I have a kitchen garden, and I grow food for guests and events and that type of thing. I don't sell food, but, as in vegetables, but we do actually, sell it indirectly when we have guests and stuff. I also make a range of artisan food, and then we host a number of events as well at the farm, and a little bit of craft. That's kind of it.
It's a busy farm by the sounds of it. And I have to say, I've had the pleasure of having lunch on the farm. Offaly Local Enterprise Office had an event there a year or two ago now, I think, Margaret, at this point. But it is it's a fabulous place altogether. And even the drive in, it's quite idyllic. But when did you decide that, okay, we're going to have a farm here, but we need to do right by the environment? How did that all come about?
Well, I suppose realistically, it came about in the late 90s because my father and mother switched to organic, in 1998. So they were early adopters. So the mindset was already there. And in addition to that, I did the Young Scientist exhibition in 1980 on the recycling of waste materials. So I was we're kind of green in nature, so it wasn't too wild a step, and so mum and dad were and then I've only come home to the farm in the last, 10 to 12 years. So it was just taking up the mantle and going from there, and being more enthusiastic, I suppose, and just embracing the whole hedgerow thing. And that's really, I suppose, the avenue that I went down was the trees and the planting and, wanting to do agroforestry and all that kind of stuff, So
explain to me, what's the difference between organic farming and farming for nature?
Farming for nature isn't exclusively for organic farmers. Farming for nature is just people that adopt practices on their farm that enhances and will encourage biodiversity and work in tune with nature, not to fight against it. So I suppose and that would include what is termed conventional farmers. So to be specific about it, a conventional farmer, as it's termed by the Teagas's of this world and anybody in the industry, a conventional farmer is somebody that's non-organic. Okay. So that's the easiest way to describe it. So you have a conventional farmer who's non-organic, or you have an organic farmer, or indeed you could have a biodynamic or a regenerative and all these other terms. But they're the kind of the simplest splits. So farming for nature is inclusive of everybody, provided they're doing something for nature. That would be my easiest definition for it, Yeah. So they do in fact have conventional farmers, but that they're putting in ponds or they're growing trees or they're regenerative or whatever the aspect is,
And I ask you that, Margaret, because sometimes I think when we talk about, farming and environmental matters and sustainability, these terms, they get bandied about a lot, and we can get overwhelmed by the language of it. So then, when you took over, the farm was already being run as an organic farm, is that right?
Yeah, that's right, yeah.
And then you take over and decide we can do a bit more. So how did you start out?
Well, I had to start out basis because I had to learn, because I hadn't done it before. That was kind of step number one, was to, physically learn how to drive a tractor, physically learn about cattle breeds and buying bulls and selling stock. And, everything was new. Every aspect of it was new. How to grow grass, how to strip graze, how to make the farm do more and put on a higher yield on cattle without giving them artificial feeds, as in, how would you say, that you weren't putting preservatives and, I don't know, herbicides and all the stuff that the conventional guys do, the things that I actually know nothing about because we never did it, But at the same time, I also knew that I need to get more weight in the stock. And the only way to do that in our system is a grass-fed system. So you have to mind your grass, So it's not very complicated, really, but it's just how do we... we had no wintering facilities, no shed facilities, so, we would be tight on grass. I mean, this is a bit periodical, but I mean, we'd be tight on grass up till May, so it was kind of like, how do we have grass earlier in the year, So the only way I could do that was to start strip grazing and just manage the grass and have more paddocks and, mob grazing type scenario, just keep moving them all the time. I'd be moving cattle every day, and from the spring right through, which is a bit more work, but that's the choice I've made, when it works for us. And then also having lighter cattle on the ground and having more traditional breeds. And
it sounds, Margaret, like it was a massive learning curve. And I think that's what sometimes puts people off from making these changes, that you do kind of have to go back to school a little bit on it to figure out what might actually work for you and your land.
Yeah. Yeah, no, absolutely. And the other thing, I suppose because I came from, theatre and arts and event management, and a very different, very, like, not wearing wellies
A very different world.
and yeah, totally. So just even the breeding season and just every aspect of it, and trying to tighten up the breeding season, and you know it's actually interesting, you know what I mean? A challenge, it stretches your brain, it makes you think, you wonder how you're just constantly driven to how you can do this better, well, at least I am, so, and I suspect every farmer is. So it's just kind of how can I, what do I need to do? And then you talk to people. Farmers are great for talking to people and asking questions, and trying to figure stuff out, so, and learning from their peers. um so essentially, you kind of have to learn by your mistakes, terrible thing to say, but that's the truth, you know what I mean? So you do something and you stand back and you look at it and go, well, if I'd done that differently, maybe my outcomes would have been better or worse, or whatever the case might be, so that's kind of how you learn on the job, so to bring it back to Farming for Nature, I'd be quite what would be the word, um excited about the prospect of that network of people, that you're kind of in a community that is on the same page as and some would be doing things really, really well that you could learn from. Or it's not about learning from everybody, but it's just, that's a natural progression, that people aspire to do things better and move on, in whatever shape or form. So I just think it's a good environment to be in with like-minded people.
So talk to me then about, you mentioned the hedgerows and the planting of trees. So, like, we would have had a culture of, well, the farm hedgerows had to be neat and tidy. They had to be safe for traffic on the roads, and of course, and all of that. But hedgerows were quite neglected, and now we know better, and we know the value that they bring to biodiversity. So how have you managed the hedgerows for your own farm?
Yeah, so they had all been, in the main, quite old, quite straggly, and Dad had started work on them under various different rep schemes and stuff like that, and he'd planted more new hedges more than anything, do you know what I mean?
Mm-hmm.
And then he'd laid some, but he'd put in the foundation, and I've just gone on from that and been more focused on laying hedges. And I suppose because it's more on trend, now than and it's constantly, and it's very much becoming on trend. And I suppose the latest glass scheme is supporting that, or acres as it's called now. So in my case, I don't know, we've about 800 meters that we have, certainly more than that. I can't remember now exactly, but up to the max of what the acre scheme was, we put in. Coppiced hedges have, infilled with new native hedgerow, and to include trees, be it, crabapple, oak, whatever. And then also have laid a lot of hedges, like, so in the last. So it certainly started, personally started laying hedges 8 years ago. Dad would have been doing it a bit earlier than that. And then anything that he sowed, I've now laid, so. And
explain
quite a bit.
For the listeners' benefit, what does it mean to lay a hedge?
So any tree is, stands on a like a stem, or, whatever you want to call that. Do you know what I mean?
Mm-hmm.
So what you do is at about age 12, in my opinion, within the year, the tree is, it's a hedgerow plant that's put in, obviously, as a whatever you call those little things, can't remember now what they're called, whips, so you put it in as a whip, and then you wait for it to grow for 12 years and try and keep the weed off it and manage it that way and fence it off, obviously, that stock don't eat it.
Mm-hmm.
And then at that time, and they're usually double row, they're normally a foot apart and all the rest. And then you just take an axe or take a chainsaw, if you're pretty skilled at that, and knock it over, essentially, is the easiest way to put it, so that it's on a flexible hinge. This is called bleaching, but it's basically on a hinge. So you don't take so much out of it that you cut it completely, but you have enough that it'll bend over. So you take some of the upper branches off the top, and then you just literally flick it over, and then you just keep doing a whole line, and you do that it's that the sap is running uphill, and then you can what's called stake and bind it, which is traditionally what we would have done. We've just lost that heritage. So they've retained it better in England and they have it in France and stuff like that. But we had essentially lost that. So there's a lot of people being trained in it and there's a few people doing it. And it's an expensive little hobby, you know, to be paying to have your hedges laid. But it's the best stock-proof hedge, in my opinion. You know, it is just the best stock-proof hedge. And you fence that off for a number of years and then you should be able to open it up, you know.
And then
it's super for biodiversity.
Yeah, talking about the biodiversity, because obviously, like, okay, you have to have it stock-proof. Like, you've got cattle, on the land. They're fairly hefty. They if they try and plough through it, they're going to do serious damage. So you have to fence it off. But then, by managing the hedge in this way, you're allowing, you know, like native species grow, but then benefit to insects, birds, and all of that sort of thing.
Yeah. And to explain, just before we move on, is when I say stock-proof, is that most people plant a hedge and then they use a flail and that's how they manage the hedge. And that's fine in and of itself. But at the base of that hedge, you have just long stems that sheep or cattle can get through and can munch their way through. But when you when you lay it, you're just making a much firmer stock, which is torn from the base all the way up. Because anywhere you've cut, reconstitutes itself, so you just get upward growth plus the growth that's laying on its edge, if that makes sense. You know, that's been laid over. So that's what makes it incredibly stock-proof. And for that reason, then it's a super fence. And then you can manage it with a flail in a number of years' time if you want to kind of keep it in an A-frame. And that's technically what it is. And then to refer to the biodiversity of that, obviously anywhere that there's a nature corridor and you have field mice, you've shrews, you've foxes, you've badgers, whatever, all of the various different mammals that we have and bird life and insects and everything else, they all live in that environment because it has feed, it has shelter, it has cover, it's everything. And I was involved in moth trapping exercise all this year, so it started in April and went on till October. And we had to use a particular field all the time and in the same place because obviously we needed to be able to manage and averages, and you couldn't be just moving your moth traps around every day willy-nilly. And so unquestionably there was always more moths in the hedge, close to the hedge, than there was in the middle of the field. That's just, so that to me was proof in and of itself that hedges definitely support biodiversity,
So then becoming a Farming for Nature ambassador, what exactly does that mean for you, and what are you going to do with your ambassadorship role?
Big question. What it means for me, it means the world to me. It's just, it's validation, I suppose, of what it is that you're doing. It's joining a community that you have loads of admiration for, an organisation that you hold in high esteem. Brendan Dunford is an exceptional man, and then his team are equally exceptional. And I went to the Burr Winterage event, which is only like in the last 7 days, and that, was very informative. I was awarded the Nuffield Scholarship 2 years ago, and that was, at the time, like I was beside myself. But this means way more to me. Way more to me.
Well, Margaret Edgill, congratulations on becoming a Farming for Nature ambassador. If you'd like to find out more about what it means to farm for nature or even to get involved, you can go to farmingfornature.ie. Margaret, if listeners want to find out more about Mount Briscoe, where can they learn about you?
mountbriscoe.ie. And we also had a hedgerow event in September, which was basically, inviting a number of artists, and that's going to be an annual event. Our Christmas event is coming up on the 14th of December, and we're having not a beekeeping lecture, but like talking about from the flower to the table next Thursday with John Donoghue, the local beekeeper. So there's a lot going on at Mount Briscoe in its own little organic fashion,
Well, check out mountbriscoe.ie for all that information. Margaret, congratulations once again, and thank you very much for joining us on Let's Go Green.
My pleasure.
We'll be back after the break.
Let's Go Green, sponsored by AirGrid, managing and operating Ireland's electricity grid for a cleaner energy future. Check out airgrid.ie for more.
You're listening to Let's Go Green here on Midlands 103. I wanted to bring you an item of news, and it is something now that I'm going to invite Minister Darragh O'Brien on the show to speak about. There is a relatively new scheme. Now, it had been piloted in 2022, but it's been officially broadened out in the last couple of weeks, and that is a new scheme for free solar panel systems for people who are dependent on life-protecting medical equipment and technology. So some time ago, when I would have mentioned it on the show about the importance of, if you are a particularly medically vulnerable person, registering that information with your energy provider. It's actually a very simple process. Some of the electricity providers have a form you fill out on their website, or sometimes you just do it over the phone. I know I've had to do it because of my type 1 diabetes and my medication needing to be refrigerated. So electricity is of particular importance to me. And, you know, I can't be without power, say, if there's a storm damage for particularly long periods of time. But the government has announced that the solar PV scheme for medically vulnerable customers is going to include all homeowners that are registered under the life support category of the Priority Services Register. So I will, as I say, invite the Minister on the show to speak about the scheme, but this is your call to action. If you are somebody who perhaps uses dialysis equipment at home, or some other form of medical equipment that or treatment that you are medically reliant on having a consistent electricity service in your own home, it's important to make sure that you're registered so that you can then avail of this new scheme, which is going to provide free solar panels. Now, as I mentioned, there was a pilot of the scheme in 2022, and during that, 470 homes benefited from the scheme. And now the government wants it to be expanded to all of those who are under the life support category of the Priority Services Register. Now, as we understand it, your energy provider will communicate this directly to eligible customers in the coming weeks and months. They are currently revising the eligibility criteria for the scheme. And then the energy suppliers, you know, the likes of or ESB or Bord Gáis, or the list goes on. But now is the time to make sure that you are registered if you are indeed medically vulnerable in that way, and so that you can be notified when the criteria are revised and the scheme starts rolling out. It will be interesting to see how it all works. There's certain criteria for it. The house must have been built and occupied before December 31st, 2020, for example. So new homes won't be eligible for it. My guess is that that's the very basis that most new homes are either A or B rated, and that your house has to be, or your home has to be, deemed suitable for solar panels, of course. So obviously if there's some kind of a structural issue, then that's not going to go ahead. But it is something that's very interesting, because I know there'll be a lot of people interested in these issues, and who listen to Let's Go Green each and every week, who fall into this category of being medically vulnerable, but perhaps don't have the finances to get a solar panel system set up, or to go down the retrofitting route on your home just yet. So it is something that we're going to look into here in the show, so we can find out more details about it, and in particular the eligibility criteria, because of course that will be particularly important. And it'll be, another way to try and avail of solar panels for your home, and I suppose a helping hand along the way. And I'm hoping that whatever sort of application process that there is, that it will be easy to navigate, because sometimes the difficulty lies in the application form, like in many of these situations. So hopefully it will be a relatively simple process. So it's one to keep an eye on, and one we will look into here in the show. But in the meantime, it is worth your while picking up the phone and making sure that you are registered, if you are entitled to be, of course, registered as a medically vulnerable person for priority electricity services with your particular energy provider. I'm afraid that is all we have time for on this week's show. If you want to check out Farming for Nature and find out more about it, go to farmingfornature.ie. Of course, congratulations once again to Margaret Edgill, who was awarded a Farming for Nature Ambassador. And of course, my thanks to Dr. Caoimhe Clarke of the Climate and Health Alliance for joining us here on Let's Go Green to talk about their new report, which is Active Travel, the Magic Pill. I'll be back same time next week here on Let's Go Green on Midlands 103. In the meantime, if there's an item you'd like to suggest for the show, please do feel free to get in contact with me. Drop me a line to hello@thecommunicationscoach.ie or send me a message from midlands103.com. Stay safe and have a fantastic week, and we'll be back same time next week here on Let's Go Green.
Let's Go Green, sponsored by EirGrid, managing and operating Ireland's electricity grid for a cleaner energy future. Check out airgrid.ie for more.